But stones essentially feel just like a stone. You can hear these clanking.
Hi everyone, I'm Lynn from Cavy Central Guinea Pig Rescue.
Everyone, I have here with me a gorgeous little guinea pig called Vanilla. Now Vanilla has come to me just to spend a little bit of time to find some friends, but also just to get a couple of things checked on. So she has a couple of issues and we're going to work through those in two separate videos. So in this first video, we're going to take a look at a little tiny stone that she has. And in the second video that I'll put out, it will be about her ears. So I'll put a link to the second one below shortly. So let's take a look at the first one. Now Vanilla, we're going to tip her upside down so we can see her little bottom area. And what's going on here is that she has a little urethral stone, but it is quite high up. Now, people often ask, how do you know if a guinea pig has a urethral stone or a stone that has moved out of the bladder and it's traveling down the ureter? When stones form, they occur up higher in the bladder, which is around this area, and they move slowly out of the body if they can progress down the ureter and then out. Now this little girl, I can actually palpate and feel this lump, which is here, and she can see she's jumping. She knows it's there. It's quite sore, isn't it, sweetheart? So it is there. It's quite high up, and it's in an area that we can't actually access. Now, she can actually look at surgery, but what we've tried to do is actually have that flush with a little bit of oil and have it move out slowly. And we've found some success with this. So she had that applied yesterday and it still has a long way to go, but we're going to take a closer look today. The first thing I'd like to do is apply some numbing agent so that we can look there comfortably and just get an idea of how far along it is. It's one thing to be aware of too with surgery for large stones, of which we had this done. That is often a preventative for people when, particularly in this climate, it's just not affordable. So, and I'm talking about 2,000 Australian dollars for that surgery, which is quite extreme. So prices vary considerably depending on who is actually involved and who's preparing the quote, but obviously that's not, affordable for all families. The second issue is that it is quite invasive and normally results in an area of about half an inch to 1 inch surgical incision site down in that region, which also interrupts their ability to then recover in terms of urination, swelling, disruption to their eating habits, and possible risks with death during surgery. So there's a lot to weigh up when you look at stone removal. Now, in this little case, we're going to try everything first. She's actually urinating fine. We're keeping an eye on the stone. The stones, when they do get very large, can actually stop them from urinating. And in this way, it causes an enormous problem, and they can die from that if it blocks that area. So you have to monitor these animals very, very closely. But let's take a quick look now. Actually, what we're going to do is put her down for about 15 minutes, and then we'll take a closer look at where things are at. Okay, so a lot of people ask me, how do you tell if a guinea pig has a stone in the ureter? And we've got Vanilla here that we're going to discuss this with. But stones essentially feel just like a stone. You can hear these clanking. These are from the last few weeks. And this will give you an idea of the size of the stones that can be removed when they're traveling outwards, but they get stuck at the end of the ureter. It's quite a large thing, can be, for some guinea pigs. And of course, if they can't pass through them, it becomes an enormous problem. So in Vanilla's case, she's had some pain relief on board now for about 15 minutes. We're going to take a quick peek at what we can work out with the stone that she has and the position of it. We cannot remove stones if they are not near the exit point. Let's have a little look with you, sweet boy. So, how do we know she's got a stone? When you hold your guinea pig in this position, your thumb can feel across the area directly above where their little bottom is. And what you will feel under the skin is almost as though there is something hard in there. This should feel soft. And in this case, as I move my thumb over at this point here, there is a lump. So we move over again, a lump. And it's quite a decent size lump as well. So I'm just going to change this position a bit, like that. I know, and put my glasses on so I can see a little bit more about what's. And the next thing you'd notice is that when you do have a look under magnification, you'll actually start to see bladder sludge down in this area, and it's quite yellow and creamy, and it's typical of what you will see being left on bedding, which is almost like a crystallization of creamy white material. Bear in mind that if a guinea pig was to eat some kale, they actually leave a discharge like that quite naturally. So you'd want to be seeing that discharge all the time. Stones, as they travel down, can cause pain, and they can also block that area, making it very easy for guinea pigs to get infections. So in that way, you often need them to be on antibiotics, or as a first port of call, you may think that they've got a urinary tract infection, which is not always the case. So I'm just putting a little bit of oil on there to make that area a little bit softer. I know that stone is not ready to present at all. It's very sore. So we're just doing a bit of investigation for now. We may just put some more oil in there, and we'll get her back in about 2 weeks to check the progress. Good girl, good girl. Now, this time around, I'm just going to very carefully just trying to get the stone is still quite high up, too high for us to work with at this time. So we're hoping to loosen it, because stones are really dry and they can often adhere to the edge of the ureter. Now in particular, they hurt. So guinea pigs will stop eating as much, and that's often the first sign people notice with their animals, is they're not eating as much as they normally would. And in this way, they stop eating. They slow down on drinking because they know if they're urinating more, it's going to hurt more. So they stop doing this. The knock-on effect is that it's even more dehydrated down there, so the stone stops traveling and becomes caught. So by putting a little flush in with some very thin, highly viscous oil, we can enable this stone to be a little bit manipulated, so hopefully it will start to travel again a little bit further out. And then in a week or so, we'll be able to come back and revisit, or she will have actually been able to part with it, which is the best scenario. But if we can get it traveling down a little bit further, then we can remove it. And we've just had a little idea that's taken 2 weeks for that process to happen, and we've removed the stone. Now bear in mind, if they have one stone, they may have others. So in the instance with this other little girl, she has had an ultrasound to confirm that it is in fact one stone at the moment. So you have to be so gentle in this area. Good girl. There you go. Just gently massaging this. Just going to need to wait a little bit more. It's literally here, about 1 centimetre down. So we are going to keep an eye on Miss Vanilla, and we're going to keep her. It's really important, if a guinea pig has stones or you suspect them, that they continue to eat and drink as much food in terms of liquid so that they are urinating frequently, because you want that flow to constantly be occurring, and their natural behavior is to try and stop doing that, so because they want to avoid pain. The management of cases like this really should be under a vet or someone experienced that knows what they're dealing with. All of these animals we typically have with an ultrasound so that we can see what stones are involved and the position of them and the necessity or not for actually going ahead with surgery or other actions. But as mentioned before, there's lots of considerations. So in this case, Vanilla is not one of our piggies, but she has an owner, and of course there are costs associated with surgery and everything else that needs to be considered. You cannot leave an animal in pain, and if a stone becomes so painful, causing issues, then we need to look at, if it can't be a surgical intervention or other intervention, then you do need to consider euthanasia. And that's a really hard topic. Again, we've got videos on that, but you cannot have an animal ever suffer. It's really important that pain management be absolutely paramount in anything that you do with them. So, Vanilla, you feeling okay? Yeah, hopefully she's going to pee out that little stone that's there. We'll keep you posted. Okay, bye everyone.